So let me just provide some background for today's breakfast symposia. I'd like to remind you that, interestingly, the normal kidney actually has a very large capacity to excrete potassium and maintain a normal serum potassium concentration. And just to illustrate that, I wanted to share with you these 5 clinical studies. And notice that in response to a large increase in dietary potassium in each one of these instances, the plasma potassium barely changed at all. Again, just to illustrate that the normal kidney can handle a large potassium load without much problem. And so the question arises, why does the kidney possess this very large capacity for potassium secretion? And one large or very popular theory is that it may have been an evolutionary characteristic of the kidney to handle large potassium loads. By that I mean, if you look at the diet of prehistoric man, it's actually estimated that they had a dietary potassium intake nearly 4-fold higher than what we ingest today, that they ingested roughly 15,000 milligrams of potassium per day. Now, it turns out that with the onset of agriculture about 10,000 years ago, there's been a progressive decline in our dietary potassium intake, and that's been accompanied by a progressive rise in dietary sodium. So, in essence, one could argue that in today's society, there's actually a mismatch between what we take in our diets and what the evolutionary design characteristic of the normal kidney was. In fact, with regards to this progressive decline in dietary potassium, the most recent public guidelines as to how much potassium we should take in today actually has labeled potassium a nutrient of public concern. That is, the typical dietary potassium intake is much lower than what's actually being recommended. And this lack of intake of potassium and excess sodium has been linked to a variety of disease states. And so what are, in fact, some of the potential benefits of a diet that's enriched in potassium? Well, it's been associated with a reduction in blood pressure. This effect tends to be greater in African Americans and in a setting of a high dietary salt intake. And the mechanism is thought to be due to a natriuretic effect that's associated with high K intake. There's evidence that dietary K actually decreases adrenergic outflow, and there may actually be a direct effect of potassium on the vascular tone. Epidemiologic studies have shown that high dietary K intake is associated with a decreased risk of stroke, and that seems to be an effect that may be even beyond just a blood pressure lowering effect. There's favorable effects of dietary potassium on bone health, perhaps related to some of the alkali that's found in the foods that are typically enriched in potassium, but there may also be some direct effects of potassium on the bone cells themselves. And then lastly, a K-enriched diet has been associated with decreased risk of nephrolithiasis, once again in part related to the alkali load that's found perhaps in those green leafy vegetables, the kinds of foods that have a lot of potassium. But again, there's also some evidence that high K intake might actually lower urinary calcium. So the only reason that I provide this kind of little background information about diet is, interestingly, our reflex in chronic kidney disease patients is to restrict dietary K intake. And one wonders that if you liberalize the diet in these individuals and could prevent hyperkalaemia, might that actually be a novel strategy in our dietary management of these types of individuals?